In my experience, every bariatric surgery patient is concerned about damage to their little stomach pouch after their operation, like a gastric bypass or a gastric sleeve. And this is truly a valid concern because patients have heard about other patients who have damaged their pouch with a rupture or a leak or other complications, and they've also heard about patients who have stretched out their stomach and gained all their weight back over time, which is a tragedy. Because patients invest lots of time and energy and money and emotional energy into the success of their bariatric surgery, so they have appropriate concerns about taking good care of the operation and having the best success in the long run. My name's John Pilcher. I'm a bariatric surgeon in San Antonio, and I'm happy to say that this idea of damage to the gastric pouch actually does not happen very often. It's pretty rare, and yet we're aware of some cases where there has been early damage leading to rupture or leak, and later term cases where patients have re-expanded their stomach pouch. And so we'll have a chance to talk about how those things happen and why they're actually very rare, and then move from that into also how to take the best care of your pouch in the long run to train it to work for you in the way that's going to give you the optimal long-term success. Now, as we talk about the potential for damage to your little stomach pouch, we're really talking about the potential for food to cause excess pressure and to lead to some type of damage, short-term or long-term. Our understanding is that thin hydration fluids, as long as they're not carbonated, really can't cause damage to the stomach pouch. Fluids can move easily upstream, that means vomiting, unfortunately, or downstream out of the stomach pouch, and they can move easily enough that in our experience it's really basically impossible for fluids themselves alone to cause damage to the stomach pouch. I've recently posted a separate video on this topic. And as we think about the potential for food to cause too much pressure in the little stomach pouch, this is going to mean potentially different things at different times after the surgery. In the first 2 or 3 weeks, it's actually possible for food to create so much pressure that it causes the seams or the staple lines of the stomach to separate, and that's what we mean by gastric pouch rupture or leak, and we're going to come back to that in a moment. In the longer term, the concern about repeated overstuffing of the stomach pouch is that it can gradually make the stomach physically expand. Also pretty rare. We're going to come back to that also. And then, as I promised at the end of the discussion, we're going to talk about some ideas for optimal stomach pouch training so that it can work well for you in the long run. Now, as far as this early time frame and the potential to actually cause damage to the stomach pouch, it's important to understand that right after the surgery, the stomach behaves differently than its natural condition. So normally the stomach tissue is very stretchy, like a kid's balloon. It can expand up and then collapse down to its very small size without any damage at all. But right after the surgery, the first 2 or 3 weeks, or really even the first couple of months after the surgery, there is natural swelling of the tissue, and that leads to stiffness of the tissue. So the typical experience for bariatric surgery patients is that they can go from a feeling of being empty/hungry into being overfull in just a bite or two. It can actually be pretty surprising. And in fact, it's pretty common for patients to have this experience of overfullness and discomfort and pain and nausea from eating. And the eating, we could say a couple different ways. You can eat too much, you can eat too fast, or you can fail to chew thoroughly. I think that pretty much captures the potential for creating too much pressure from food. And that's not a universal experience. It's not necessary to have that in order to be successful after surgery, but it's common enough that we can think of it most often as a learning experience. So the sense of overfullness from 1 bite too many or 2 bites too many is, like I said, very common. And as long as you take that as something to modify and to not re-experience over and over again, then that is going to fit with good long-term success. Now, we're aware of just a very few rare cases where patients in the early time after surgery have had this sort of continued compulsion to eat and ate large amounts of regular food like a cheeseburger or pizza or something like that within a week or certainly within 2 weeks after their surgery. And in these rare circumstances, these patients had some issue that drove them to override the pain and the nausea situation and to force food down. And I mean literally a full-size double cheeseburger plus fries 7 or 10 days after surgery. And those are the rare circumstances where patients have caused damage to their gastric pouch. I get really specific on this just so that you can know that most of our patients wouldn't imagine doing doing this, and even these patients who did, I think they wouldn't have imagined that they were going to do it, but they had kind of a compulsion that we had not picked up on before surgery. So once again, for most patients, the best thing is to just be gentle with your stomach pouch. And as I'm going to mention in another video that's coming up soon, the best way to have long-term success is to be very gentle with your stomach pouch and not to ever have the sense of overfullness. You can actually do that, and that's a very rational approach. Before I transition into a discussion about the long-term potential for pouch stretching, I realize I forgot something about that time frame right after surgery. On these occasions, which I said are pretty common, where people eat a bit too much and feel overfull, they may get to a point where they actually have to throw up and relieve themselves of that pressure to get rid of the food. And throwing up after bariatric surgery can feel very traumatic. You know, you've all had this. And so it can feel like it's bad on the incisions. It can feel like it's bad on the stomach pouch itself. And here again, I can reassure you that the occasional episodes of throwing up are not damaging to the stomach pouch. We obviously don't want these to reoccur over time, but they are not damaging or tearing in and of themselves. Obviously, if you're concerned at any point, please do call your bariatric team. But as I said, just the occasional 1 or 2 episodes of overfilling is typically not going to cause any ripping or tearing, or even if it might feel like it. Now, from that, moving into the longer term concerns. And this is the concern about weight regain and pouch stretching or stomach stretching back to its normal size. It's a really common sensation, and so I want to begin, as I reassure you, by expanding on this idea about the natural healing and evolution of the stomach pouch. And as I mentioned just a moment ago, it's expected and it's natural that early on the stomach pouch is going to feel fairly stiff. And just remember that natural stomach tissue before surgery is kind of like a kid's balloon. It's very stretchy, and that's why humans can eat incredible amounts at Thanksgiving. And this is probably a good leftover from caveman days, where those guys would not get food very often, and when they did, they had to fill up as much as they could before somebody else came along and got that food. So again, it's natural for the stomach to be able to stretch out a lot. This is not damage, and it'll shrink back down once it's empty like a kid's balloon. But as I said, in the first month or 2 after the surgery, this stomach is going to feel a lot more stiff or resistant or rigid, and we might make a comparison of like an old-fashioned hot water bottle. So it's got a little bit of flexibility, but it's just a little bit of space from being empty or unsatisfied to being overfull and uncomfortable. And then what does happen, both sleeve and bypass, very naturally as the healing process goes along, and this is 2, 3, 4 months after surgery, is that patients will feel like their capacity sort of suddenly expanded massively. And this can be scary because early on you may become dependent on the fact that your stomach makes you stop eating so that you continue to eat little amounts. As we're going to discuss, I'd rather you didn't depend on that sense of fullness. We'll come back to that. But it's a change that happens at, again, 3, 4, 6 months after the surgery, and it can make you anxious. But I want to reassure you that that change from stiff and small to being a bit more stretchy and capacious, more capacity, is a very natural change. And that does not mean that your stomach pouch has been damaged. It just means that your stomach has returned to its natural distensibility. The second thing I want you to know is that we're structuring or creating your little stomach pouch using what's called the lesser curve of the stomach, which is the least stretchy part of the stomach, so that it has a very little tendency to stretch back out over time. And in fact, it's very common when we see our patients at 3 years or 10 years down the road, and for a variety of reasons, we want to recheck the stomach pouch to make sure that it looks okay, check the structural integrity of the little stomach pouch. We typically do find that the stomach pouches are right there, pretty much exactly as we made them, and still appropriately small so that they don't have any excess capacity and have not been damaged over time. And yet, patients have this experience of being able to eat relatively large amounts of food, and so it can be kind of a mismatch or a mystery or lack of credibility for the surgical team to say, well, your pouch still looks good. You can say, well, how is that? Because I can eat now the cheeseburger and the fries, 3 years after the surgery. And so what does happen over time is that, as I mentioned, the sensibility comes back, and also the stomach pouch becomes fairly effective at transitioning the food out as it goes downstream. eating. And here I'm going to circle back to a very key point that I'll use at the end of this video, is that you actually can train your little stomach to handle large amounts of food if you unconsciously train it in that way or work on it in that way. And this is not damage, but it's a process that you can train it into. The good news is that you can train it into feeling smaller and getting full more easily, which I'm going to circle back to. One last practical note about what does it mean to overstretch the pouch. In these few cases where we actually have seen this, we're aware of just a few patients, and this has been a couple sleeve patients and a couple gastric bypass patients, who starting early after their surgery have followed kind of eating compulsions and have really overstuffed their stomach multiple times a day, many times a week, over a period of years. And what we're talking about here, so the patient experience on this is that they eat just as much as they can possibly hold until they feel super uncomfortable, maybe even until they throw up, and they do this repeatedly, day after day, week after week, month after month. And in those few circumstances, patients have re-expanded their stomach pouch. And in those patients, unfortunately, it's probably not correct to go back to surgery because we need to be working on the eating compulsion instead. But I emphasize that in our whole practice, and as the practice we're at, I don't know, 15 or 20,000 operations, we've seen this in probably less than this many patients over time. So this is not something that the vast majority of patients experience. Hopefully in the last few minutes I've been able to reassure you that the risk of actually breaking your stomach pouch is really low. And now most patients are still interested in, okay, how can I get the most out of my stomach pouch? And I would love to tell you how you can nurture your little stomach pouch so that it takes the best care of you. And there's going to be two overarching themes for this. Number one, I recommend for you to eat in a way that's conscious, thoughtful, aware, attentive. And number two, I'm going to recommend that you pay attention to your hunger level and mainly use hunger to decide if or when you eat. Okay, so what about conscious eating? So conscious eating to me means that you try to be actually aware and choiceful and intentional about all the aspects of eating. And that starts way back with the food anticipation and food acquisition. So when you're shopping, be conscious, be thoughtful, look at the labels. When you're preparing the food, also be conscious of what you're doing. Certainly while you're eating, as we're going to talk about in a little bit more detail, have your mind in this and don't try to multitask, hopefully. Even in the cleanup phase, I would like you to be conscious and aware. What do I mean by not multitasking? So I hope that when you're eating, you're going to develop a habit of not watching TV or reading or doing some other kind of electronic distraction activity. I think social eating can be okay because that has important significance, but so conversation, yes, but these distraction things that all of us do, I think are counterproductive. I'm going to want you, please, to focus on how does this food feel in your mouth, what does it taste like, what does it feel like going down, when does hunger subside, and these kinds of things. And if you don't have the time available to eat in a conscious way, I'm going to recommend that you wait until you have the time. And yes, I am asking you to invest more time in the success of your surgery, but I think this is the way, in little investments day in and day out, that we keep this within the realm of normal human effort. So consciousness, number one. Number two, as I've discussed extensively elsewhere, the bariatric operation ought to give you a smaller, more tame, or more healthy hunger. And so it ought to be practical for you to notice your hunger and to use hunger as your main signal for eating. In other words, not to eat on a certain schedule and not to eat with a certain numerical target in mind. And it's so common in our field to have certain protein targets. As I've discussed elsewhere, I think those protein targets may be a little counterproductive. I think that moving into the next principle, this is going to lead very nicely and naturally into a very good habit that we call intentional fasting or intermittent fasting. So if you really follow your natural hunger, you're most likely going to eat once or twice a day, maybe 3 times a day, but usually not 3 times a day. And I'm not a fan of intentional fasting to the degree that you're uncomfortable and starving, but I think that if you follow your natural hunger, that hunger is not going to be very frequent or very bothersome. In my experience talking to patients, it's very common for patients to sort of like fear hunger and to want to avoid hunger, and sometimes they'll eat to avoid hunger. I've got an upcoming video planned that will hopefully relieve people's mind along those lines as well. Conscious eating also applies to food choices, and my ideal foods for you are going to be solid foods that are low carb. And yes, we like protein. I like green vegetables and salad types of foods as well, and we're not against natural fats. And so there's a wide variety of solid foods that you can eat. We don't want mushy foods most of the time, and we don't want soups most of the time, because these are physically going to slide out of your little stomach pouch sooner than we would like. The ideal scenario when you feel hungry is that you're eating some solid food, let's just say chicken nuggets, and those chicken nuggets are going to sit in your little stomach for a little while and give you a sustained, lasting sense of satisfaction. So food choice is a next step in working with your stomach pouch as well as possible. The next part of this pouch training process is to pre-hydrate when you sit down to eat. And again, this is a very conscious process. What I would like for you to do before you pick up the fork or pick up your chicken nugget or what have you, is that I would like you to pre-hydrate with a substantial volume of water or a similar non-calorie, non-carbonated fluid. I want you to drink 8 or 12 ounces before you start eating. And this is because, again, we don't want to liquefy the food. So you're not supposed to drink with your food, and we want you to be well hydrated. So to pre-hydrate keeps you up on your hydration, and also drinking briskly will lead to just a gentle stretch of your stomach pouch, takes the edge off of the hunger, so that then you can eat under control. And that segues very nicely into the next natural step in the conscious eating process, which is I want you to try to make your small meal take at least 20 minutes. And there's a couple things going on here, but the main goal is that the nerves that sense hunger are kind of slow when they're satisfied. So hopefully you're going into this meal because you're hungry, and hopefully you're going to stop eating when you feel satisfied, which is not quite as much as feeling full, but you need to give your body a chance to tell you when you feel satisfied. Those nerves can take 15 minutes or so from the time that they feel full, so I want you to intentionally stretch out your meal time, hopefully for 20 minutes. The next point I'm just going to re-emphasize, I would like you to stop eating when you feel satisfied, not all the way up to full. If you feel pressure, then that's probably one or two bites too many. And next time you have that type of food, I would recommend go back to a slightly smaller portion size and see if that helps you be satisfied in a way that lasts through the course of the next several hours. Just to re-emphasize, we don't want to drink with food because that will cause the food to flow through too quickly. And we don't want to use soups too often because soups basically are liquid with food, and the food will flow through a little bit too easily. And as I mentioned, unfortunately, it's possible to train your stomach to handle large amounts of food. But the good news is that this conscious eating process, which means being aware, following hunger, and choosing solid low-carb food, this conscious eating process can actually retrain or reset your stomach down to feeling as if it's smaller once again, so that it can support you for excellent health for many years to come. I hope this information is helpful for you on your weight loss journey.